y'all, it's Kelly. I know it's been since 2019 since I did my last update. My apologies. Life has been hectic. I yet again have relocated, and I'm just going to kind of quickly update y'all on my health, and then I'm going to circle back around to a video that I posted 5 years ago due to a comment that I got. Now, I still have moderate to severe gastroparesis. Still have celiac disease. Now, while I lived in the South, I saw a liver specialist at the Liver Institute, and they did a bunch of fibro scans, blood work, a bunch of ultrasounds, and they also did another liver biopsy on me. And I was told that I have NASH liver disease, which very well could be, well, we know now it is contributing to the pain that I've been having that is in the middle and then radiates to the right. The gastroparesis is also another contributor to that pain. Now, just this past June of 2021, I had a very severe kidney infection, and I was in the hospital with that for, I don't know, maybe 5-6 days. This is my dog, Iris. She's my baby. I had the kidney infection for about close to 2.5 months. And I haven't really bounced back from that as far as like my immune system. It's still pretty shot. I managed to get strep throat, which I haven't had since I was a kid. I didn't even get it when my son got it as he was growing up. So that was a shocker. Been fighting bronchitis and an upper respiratory infection for maybe 3 months. And I'm still feeling kind of like the throat hurts and, stuff like that. Not COVID. I've been tested, and I have had my 2 vaccines. I'm waiting to find out what's going on for me to get the 3rd. And just overall just kind of crummy. I did, however, get to be able to work at a job that I've wanted to work at forever. And I help people who are seeking early treatment for drugs and alcohol. Now, we do a medical detox, and we also have a 14 to 28 day inpatient rehab. And then we refer them elsewhere if we feel that they need to go, for further treatment. Now, as far as the video that I made 5 years ago, it was the one video. I know the last part of the title was in regards to like being labeled a drug seeker or something like that. Somebody had commented that what I had said in that video sounded a lot like drug seeking, active drug addiction, and that bothers me because that comment was and still is why I posted that video, because they see EMTs, nurses, doctors. I understand they do legitimately see people who are just there for drug seeking. However, that's not everybody. When I had made that video, I hadn't had a confirmed diagnosis as to what was going on with my stomach. They couldn't figure it out. I'd had one gastric emptying study that showed my stomach was emptying too fast. And then I had the ones showing that I did have paresis. So there was a lot of confusion in the beginning. We didn't know what was going on with me. And we didn't even know what was going on with my liver at that point. When I had the pancreatitis the second time back in 2015, 2016, around there, I did have a liver biopsy done while they took out my gallbladder, and that did show that I was close to having cirrhosis of the liver. I did a very long round of vitamin E to help get the numbers and everything back to normal. So at that time in 2015, because we didn't know what was wrong with me, my primary care doctor, who saw me at her walk-in within her building, told me to go to the ER. Now, why I didn't drive myself? 2 reasons. One, like I had stated in the video, every time I've ever gone to the ER, whether it, like I said, was for a migraine, whatever, any kind of like pain, they always ask you, how did you get here? Why do they ask you this? Because they don't want to give you a narcotic pain medication and then release you and leave you to drive, because then they're liable. Yeah, did you hear me? They're liable if they give you a narcotic pain medication and know you are personally driving yourself home. That's why they ask you, how did you get here? So when that EMT was dealing with me that day, it was the second or third time that she had come to pick me up. Now, the only reason why I ever have to take an ambulance is because I'm a single mom. Yes, my son is an adult now, but he doesn't live with me. He doesn't live near me. Back then, he was a teenager, and I needed to get my car home because I would have no other way to get it. I don't have a lot of people in my life who can drop everything, take me to the ER, or even pick me up from the ER if I manage to find my own way there without an ambulance. So that's why I drove my car home and then called for the ambulance and have a choice. Some people are not blessed in that aspect to have a significant other to count on. So that's why I drove myself home and then called for an ambulance. Now, my problem with that particular EMT was the way she talked about me to the trainee and the way she belittled and talked to me. Not everybody is going to show that they're having pain like everybody else. Like, some people are very verbal, like vocal, the moaning and screaming when they're in pain. Then there's others who, roll around and that everybody shows that they're in pain differently. I have always dealt with some pain to one degree or another since the age of 14 when I was diagnosed with endometriosis. So even then, I would get only a 2 to 3 day supply. Back then, they would do 1 month for me with Darvocet and 1 month for me with Vicodin for only 3 days, which was fine. I didn't have a problem with that. I've never abused pills or anything like that because I watched my mother growing up being very sick. I know what it's like to be in pain. So why am I going to abuse the medication that's going to help me? Now, my problem, again, was the way that she spoke to me and about me to the trainee. Completely unprofessional. If you are in the medical field, especially on the front lines, you have to have compassion. It doesn't matter. You have to have compassion, respect, and let people have their dignity with the fact that they're reaching out for help. And you're going to sit there and belittle them and talk down on them to other people on the rig of the ambulance. That's not okay. Yes, there are legitimate people who do drug seek. I get it. But you can't let that numb you to the people who are legitimately sick, may or may not have a diagnosis, but that does not give them a right to do what that lady did to me. No. And I did call and report her about that because it's not right, because she's showing a trainee how things work. But by the way she was treating me that day is showing the trainee, oh yeah, you can treat people like this and this is okay. No, it's not. Absolutely not. I worked as a CNA in nursing homes for about 2-3 years. Then I did home health care as a certified personal care aide and a certified home health aide. So I see, and I grew up with my mother being in pain. So I could never imagine talking to somebody the way that I was talked to. Like, it's not right. If you can't treat everybody with respect and dignity, you're in the wrong line of work. And the person that made the comment on that video tonight or this morning, you're the reason I made that video. I'm in recovery and have been for almost 22 years. 2015 is still within that time frame of being in recovery. I have not abused drugs or alcohol come April, 22 years. So I wasn't drug seeking. I wasn't in an active addiction. And I even believe I stated in that video that if I had surgeries where I would get a narcotic pain medication, I never took it, finished it. Like within, they take 1 to 2 pills every, some of it's 4 to 6, 6 to 8, depending. I never took it like that. I usually only take 1 in the morning and 1 at night. So if I had pills left over from a surgery, a lot of times they would be in my medicine lockbox for a year. Because I would just let it, be there because I never knew when I would have a flare-up. Yeah, that happens. Gastroparesis, celiac, and NASH liver disease, just like any other chronic pain and illness, you have flare-ups. Now, since that video, I really don't have to go to the ER for pain that often anymore because I get medical marijuana. And I'm okay with that. That works for me. Whether I get the pure THC or the 50-50, which is CBD and THC. I don't do anything else. I don't need to. Unless I have surgery. I just managed to be talented and graceful enough to break the 5th metatarsal in my foot. I was prescribed pain medication over 3 weeks ago, and I still have over half of my prescription left. Why? Because I don't abuse pain medication. I have no reason to. So maybe the person who commented on that video needs to listen to it again. I wasn't drug seeking. I was trying to bring awareness to how people are treated when they go seek for help who have chronic illnesses, invisible illnesses, and most of all, chronic pain. Don't pass judgment before you know somebody's true story. Just don't do it. Just keep your mouth shut. Or ask questions. Because I'm not in active addiction now, nor was I then. I was in pain. I needed help. And I did what I had to do to be able to have my vehicle at my house and be able to go get help. I didn't need to be judged. I didn't need to be belittled. Just like anybody else who's in my similar situations. We just want respect. And to be treated like human beings. If you can't do that, get out of that line of work. Have a blessed day.